For this PowerPoint, I'd like you to be able to describe the historical use of lobotomy and chlorpromazine, which should be reviewed, ID capsulotomy and cingulotomy, what they're used for, and describe prion diseases and be able to identify the various forms covered in class. In 1930s, Moniz developed the lobotomy to first calm, violent, and captive chimpanzees. This, animal experimentation was the first to demonstrate that neurosurgery or psychosurgery could be effectively used to reduce brain lesions to modify psychiatric disorders. While you might think of this as barbaric, we still have multiple neurosurgeries today that seem to be pretty safe and effective. Whether or not they'll be considered barbaric in 30 years or 50 years, we'll just have to wait and see. But right now, they seem to work quite well. And like I said, these are the more localized versions that are very effective at treating psychiatric disease. Shortly after Moniz's important work in the chimpanzee, psychiatrists began performing lobotomies, or by detaching the frontal lobes from the rest of the brain, to treat schizophrenia. By the 1950s, however, schizophrenics were treated with chlorpromazine, a D2 receptor antagonist, which was the first antipsychotic. This was historic. I mean, just game-changing. I mean, like before this, like the idea of outpatient therapy was not a thing. There were the old horror stories of these asylums that inspired Batman and everything else. I mean, just these just horrendous places where you just lock up people with mental illness because there's nothing else you can do. Now you have a pharmacotherapy that can be doled out relatively cheaply. And again, schizophrenic patients don't typically have very much money. They can't really, go to Johns Hopkins and get 5 years of treatment. It's just not going to happen. So, the idea of being able to give a cheap psychiatric pharmacotherapy, was just game-changing. And I think we sometimes lose sight of that. There's so much, negative views, around pharmacotherapy these days. Don't forget what it was like before pharmacotherapy existed. So before pharmacotherapy, in between just locking people up and chaining them to a bed for the rest of their lives, there was this lobotomy thing where you would actually take an ice pick and tap it in under the eye socket and then basically just wiggle it around and dissociate the frontal cortices from the rest of the brain.
He was an idealistic doctor, hungry for fame, who would champion one of the century's most infamous medical procedures.
He wanted to solve the problems of psychiatry, and he wanted to do it fast.
The lesson here is not how a man can go off the rails, but it's how science can go off the rails.
Ellen Ionesco was the first patient to undergo a procedure Dr. Freeman had perfected only weeks before. He called it transorbital lobotomy.
In a transorbital lobotomy, Freeman would first have the patient rendered unconscious through the use of the electroconvulsive shock machine.
Just before he threw the switch, we all had a laying on of hands and went for a little ride.
Usually 3 successive convulsions are necessary, but in old people a single one may be sufficient, while in a sturdy young person 4 or even 6 convulsions may be administered without danger.
The patient would then enter unconsciousness for a relatively brief period, but several minutes.
Now that the convulsion has subsided, the nurse holds a towel over the nose and mouth of the patient.
Freeman would peel back each eyelid, insert his ice pick, and with a hammer, tap through the brain, wiggle it about, sever the frontal lobes, withdraw it. And when the patient came to, he or she would be given dark glasses to hide the black eyes they'd been given.
We didn't have a refrigerator, we had an ice box. The first ice picks came right out of our kitchen drawer, and they worked like a charm.
Turning now to the operation itself, very little preparation is necessary for transorbital lobotomy.
The instrument was put in above the eyeball and in the plane of the nose. You could feel it hit the roof of the orbit, and then with a tap of a hammer, you could knock it through. The whole thing would take 3 or 4 minutes.
This patient came to the hospital this morning after breakfast, and he will leave tomorrow afternoon.
There are reports which he proudly writes down in his diary about fellow professionals fainting as he proceeds in this, or vomiting.
Dr. Watts didn't say anything. He simply turned around and walked out. Spurred on by Freeman, the number of lobotomies performed annually soared from 150 in 1945 to over 5,000 in 1949. Despite the known side effects, there seemed to be an endless supply of willing patients. Ultimately, the fate of lobotomy would be settled by a pill. In 1954, a new drug called Thorazine began to sweep through state mental hospitals.
Thorazine was initially marketed as a chemical lobotomy. I mean, this was seen as a selling point, that it produced results similar to lobotomy, but without, of course, all the risks of the surgery.
Freeman decided to move to Los Altos, California, to resurrect his career. Far from the reproachful Eastern medical establishment, he could try to bring lobotomy to new categories of patients.
If housewives found their early 1950s existence too depressing for words, why, Freeman had a solution that would get them through their day happy as little clams. If children were misbehaving, conditions we might now see being called hyperactivity disorder, why they might need a lobotomy.
In all, Freeman lobotomized 19 children under the age of 18, including a 4-year-old. By 1967, Dr. Freeman had personally performed more than 2,900 lobotomies. In February, at Herrick Memorial Hospital in Berkeley, he performed his last when a patient died of a brain hemorrhage. Freeman was stripped of his hospital privileges and soon retired from his medical practice.
Here's a real live brain where you can actually see where that ice pick was wiggled around in there. Similar to the picture in your book, this would be from the psychiatry professor that taught me. So while the lobotomy thing might have been a little over the top and crude, and frankly quite cruel, modern neurosurgeries still occur that are deemed safe and effective with minimal side effects and highly ethical currently. 2 are cingulotomy and capsulotomy. The cingulotomy involves lesions that interrupt the pathways in the cingulate cortex to treat anxiety, depression, and obsessive compulsive disorder. By contrast, capsulotomy involves lesions of the internal capsule, the white matter projections under the cortex, to treat anxiety disorder. Finally, I wanted to go over prions. Prions are abnormally folded endogenous proteins that can induce other proteins to follow suit, leading to long protein chains that impair neural function and produce disease. Now, prions, or the prion hypothesis or theory, was really advanced by a guy by the name of Stanley Prusiner. Prusiner won the Nobel Prize for this work, and he was dogged by years by critics, one by the name of Laurel Manuelitis. Dr. Manuelitis, I believe, was at Yale University. She might still be there. I believe her beef with Prusiner is that, one, he would never provide the samples that he used to prove this. And the big deal here is this dispels, at least partially, the molecular theory of biology. which is huge. I mean, that's what biology is based on almost. So a large portion of it at least. But, the idea that RNA leads to DNA leads to protein. Note, not here. Protein changes protein without RNA or DNA becoming involved. Now, Manuelitis argued that maybe Prusner missed viruses that were actually causing the protein changes. So there could be some virus, and viruses are hard to detect. We don't know a lot about viruses. And they can be tricky, very tricky. I mean, they're arguably not even living things. So, the idea that you could irradiate the tissue, which is, that's what Prusner did to prove his case, that he irradiated his tissue and still saw protein change his protein. But by irradiating it, he would have destroyed any RNA or DNA that would be there. But what if there was a hidden virus? Anyway, that was Manuelitis' argument. Everybody pretty much accepts Prusner now, and I'm not saying you shouldn't. I think it's fun to, remember that, science isn't always this just steady, constant thing. It's based on hypotheses and replication. It is important and critical that we challenge the dogma and theory out there. This is just one example of that. But anyway, prions, can lead to a variety of disorders, and they have been associated with jumping from various animals to people. Scrapie is one example. This would be a fatal disease in sheep caused by prions that can be transmitted to humans if you eat tissue or meat from the infected sheep, particularly meat that is around the spinal column. So the most famous prion disorder is mad cow disease, known also as bovine spongiform encephalopathy. So the history here is that cows in England were fed sheep that were infected with scrapie, and as a result, they developed a similar disorder that was still a bit unique to the cow. And then, when people ate this, they developed bovine spongiform encephalopathy, leading to basically a spongy brain. So, the protein causes protein misfolding, and it's just occurs over and over and over again until there's complete disruption throughout the brain, ultimately potentially leading to death. This cartoon illustrates a simple idea. So the cow would be infected with the abnormally folded protein, and then without any molecular dogma here, the protein would then cause normal protein to misfold without any genetic interaction, leading to the harmful protein growing exponentially throughout the brain, and eventually you're left with spongy tissue. So cows with bovine spongiform encephalopathy, or mad cow, were fed to people in England, and approximately 100,000 people developed a similar disorder. In people, they gave the name of this Creutzfeldt-Jakob disease. This causes dementia, sleep disorders, schizophrenia-like symptoms, and again, ultimately death. Interestingly, this occurs in animals in North America as well, one being deer herds. This is somewhat alarming to me as someone that has been to many a barbecue and had many venison steak and burgers. Grew up around hunters. I see, frankly, still nothing wrong with it. I'd still have a venison steak right now if you served it to me. But, a good hunter would tell you that they wouldn't go after a sickly deer. That's the take-home message here, right? Really across the board. If we're going to eat animals, particularly wild animals, it's very important that we eat the healthy ones. If you, I've heard people argue that we should only eat sick or already killed animals or these sorts of things. Ooh, that's incredibly dangerous. They're sick for a reason. You don't want to go near a sickly animal. That is, just a bad news. So yeah, going after the healthy buck. It's not just about the trophy. Like there is, a physiological reason to do so. But that prion disease in the deer in North America is called chronic wasting disease, and that can be transmitted to people, causing something like Creutzfeldt-Jakob's disease if you eat the infected meat, which again would also probably come from pieces of steaks cut from around the spinal column, particularly of a sickly looking animal.